The commonest reason is discomfort. It's the functionality of having to live with a big bust. It's heavy, it's cumbersome, it causes pain in the neck, in the back, in the shoulders. And women will put up with a large bust very often for several decades, and they come in and they say, I'm stooping lower, I'm getting neck pain, I'm getting big cuts in my shoulders where the bra is pulling down. And those are the main reasons. It's for function. It's because it's uncomfortable and it's giving them back pain and they're stooping. Those are the biggest reasons. This all depends on the size of the patient's chest and the patient's own body mass index. So if a person is a little heavy generally and wants a breast reduction to try and reduce their weight, you have to take that in the context of what their BMI is. And ideally, to do a breast reduction operation, I would like a person to have a BMI of less than 30. The breasts need to be out of proportion to the rest of the body. They need to be cumbersome, they need to be uncomfortable, and the person needs to say, look, I'm getting back pain and neck pain with this, and I'm actually fed up with trying to cover them up all the time. It worries me slightly where someone comes in and says, I want a breast reduction because I just don't like my breasts, because that's obviously very subjective. And if I see a person with a fairly modest sized breast, I won't want to do reduction surgery for them. I'll tell them, look, this really isn't what you need. But generally, if people say, this is really troubling me, I'm uncomfortable, I'm very aware of my breasts. Sometimes someone will say, I go into a room and my breasts go in before I do. It's quite interesting. Sometimes you get very bright, intelligent people with lots of higher education and doctorates and so forth. And they'll say, nobody ever talks to me. They always talk to my bust if I meet somebody socially. And so there can be that embarrassment as well. The answer to this is that a patient obviously has a view as to what their desired breast size will be. But it's very difficult to agree to go to a particular cup size. Now, the first problem is none of the bra manufacturers make bras that all match each other. So a 36B in a Burlite bra, for example, will be different from a 36B in a Marks and Spencer's bra, and it'll be different from a sports bra. And every manufacturer has their own way. There is not such a thing as a standard B cup or a standard C cup. The other thing is that cups change in volume according to the back size. So a 36C cup is significantly smaller than a 38C cup. So I talk to patients very much in terms of percentage. So I'll look at them and I'll say, this is the size that your breast is now. I can reduce it by 40% or by 50% or by 60%. But there is a limit to how small that you can go safely and to make sure that all the operation heals nicely. So I can never promise somebody, yes, you will be a 36C. That would actually be impossible to guarantee. So what I say is, let's have some expectations about what we can achieve. Make sure your expectations are realistic. Breast reduction surgery is performed under general anesthesia. In my hands, it takes about 3 to 3.5 hours to do because I insist on doing both sides myself. Sometimes a surgeon will have a separate surgeon doing the other side simultaneously, which is good for making a shorter operation and a shorter anesthetic. but can produce two perfect breasts that don't actually quite match. So I try and do, or I always do both myself. So it takes me between 3.5 hours. The shape of a large breast is pretty much like a brandy glass turned upside down with the nipple where the stem is. And we want to try and turn that into a much slimmer glass, but with a nipple in the same place. So the blood supply to the nipple goes through the breast tissue itself, under the skin, and through the muscles. So doing a breast reduction operation, a lot of skin is being removed, a lot of breast tissue is being removed, including breast fat, if there's fat in there. And yet the nipple has to be kept alive and has to be positioned at the spot on the new cone so that it looks right. So the key to a lot of this is keeping the blood supply to the nipple enough to keep it alive. And we do that by using what's called a pedicle of breast tissue, a pedicle of preserved breast gland with the nipple on it, which is then rotated up into the new position. A lot of women have accessory breast tissue under the armpits, and some women have fatty tissue there. Sometimes it's very helpful at the same time as doing the reduction operation to do some liposuction under the arms as well, just to take that little bit of extra volume out. Is it very painful? Well, it surprises me that the majority of women say that on the second day, they really don't feel much pain at all. Obviously, in hospital, the patient is given enough analgesic to keep it comfortable. But it's not like entering with surgery a body cavity like the abdomen or the chest. It's superficial surgery compared to that. So it's much less sore than most people expect. I never minimize the pain. I'm never a surgeon who says that isn't going to hurt. I say, yes, it will hurt, but we'll manage it with you. And you will be more comfortable, most likely, than you think. The other thing that really helps is wearing a front opening support bra for a number of weeks afterwards. And there are particular ones that give good support and they're soft and stretchy, and that helps with the comfort as well. I would advise that whoever you see to give you advice, you see them at least twice in clinic. You have a good interval between times to think about the implications of surgery. You think about the scars, you think about quality of life, you think about recovery, you think about your general health. Are there issues that might predispose to complications, for example? So if a patient is diabetic, they're at a higher risk of infection after surgery. If a person could do with getting their BMI a little less, then I say go and try and get onto a program where you can lose a bit of weight. If someone doesn't do any exercise, I say go out and get some exercise, get your legs working. We don't want any complications from a general anesthetic like a deep vein thrombosis. And then before surgery, exercise, be fully hydrated, and the 24 hours before surgery, take some extra complex carbohydrates just to give you a little bit of energy on board, because the day of surgery, you're not going to be eating very much. And also make sure that when you get home, there's food, somebody there to look after you. Make sure that you're not going to be stressed out for at least the first 72 hours.